Welcome to another edition of Barbershop Therapy. This is a special day. We're starting a new series called Man to Man Healing Conversation Series. And today I'm here with a special guest, Dr. Owen Guess. How are you today, sir?
I'm good, man. How about yourself?
Blessed and highly favored. I'm glad to see you here, Richard. Thank you for being here with us. Um, you mind tell us a little bit about yourself?
Oh man, that's a lot. That's a long story, but overall, I would say I'm from Greensboro, North Carolina. Born and raised. I went to North Carolina A&T for
Okay.
my bachelor's degree. Then I went to Clark Atlanta University for my master's degree. I'm actually a legacy there. My dad went there, as well as my uncle, and then worked at Spelman College for a little bit. My internship turned into a job over there at the counseling center there. Then lived in Shanghai for a year and a half, leased for 8 months, then came back, and then doctoral program at A&T
Okay.
University again.
Back and forth, back and
Yeah,
forth.
yeah. Double Aggie.
Right.
So I really love that. Um, and I have a 8-year-old son. So he's here in the Raleigh area. He goes to Ravenscroft, really good school.
Okay.
And professionally, for my therapy, my practice is called Neji Trev LLC,
Okay.
NTV Therapy. We're
Hey, can you
located.
say that in that camera right
Oh,
there?
my well, my practice is located at 2500 Regency Parkway, Cary, North Carolina. It's called Neji Trev LLC, NTV Therapy. It's named after my son. My son's middle name is Neji. His first name is Trevwin,
Okay.
the mixture of my middle and first name, Trevor and Owen. And so I named that after him. So yeah.
Amazing,
Yeah.
amazing, man. Thank you for that. Now, as everybody you can see, we've chose a different location. We're down here in downtown Durham at Dram and Drought. It's a local pub right here in the heart of downtown Durham. It's a 701 Suite 123 West Main Street. And they graciously allowed us to come in and shoot this podcast. And so we'd like to give them a shout out and say thank you very much for that. Um, I'm gonna jump right into it, man.
Okay.
Look, we see that you're Aggie, Clark, both historic black universities. You were born in Greensboro also.
Yeah.
So you're a native of North Carolina.
Right.
Man, you just decided to keep it at home, right?
Decided after travel,
Okay.
I always tell people I did have a shot to go to Stanford, got accepted there. But I wanted to be home. I feel like historically black colleges treat you different.
Okay.
It's home, and I was homesick. So absolutely, home is where the heart is.
Good deal. Good deal. So also in your practice, you work with adolescents, adults,
Mhm.
and preteens.
Right.
So what made you get into working with that particular group?
Well, I got my doctoral degree when I was younger. So
Okay.
I was definitely one of the younger doctors out there.
How
So
how old were you?
shoot, I got it when I was 29. So
Oh,
yeah, so
okay.
29 years old,
So
29
you
into 30.
life
So
life
yeah,
schooler? You would
yeah, I was life schooler.
okay,
It
okay.
was
Back to back to back.
absolutely my parents preached education all the time, and so it was education boot camp
Okay,
essentially. So yeah,
okay, okay. Well, cool. Well, thank you for that. And listen, let's address the elephant in the room, right? Why do you think African American men particularly don't seek therapy? And there's a caveat to that.
okay.
What are the biggest barriers, culturally, socially, and otherwise, that keep men from walking through that door?
Okay. So that's a very layered question.
Yes, it
All
is.
right.
Yes, it
So
is.
can you give me the first part of the question
Okay.
again, please?
Why do you think African American men in particular do not seek out therapy?
African American men, why do I feel like African American men do not seek out therapy?
Mhm.
Whew. That's a historical question. That's a current day question. So historically, The African American community, we're very skeptical of doctors in
Okay.
general, just because of the trauma that we've had, the experimentation that's
Tuskegee.
been
Hmm.
Tuskegee experiments, those type of things. But also, I think a lot of it is I was told, even coming into the field of mental health, I'm a unicorn. That there aren't many black male therapists here. There's not a lot of male therapists in general, and even a black male. So I think representation matters a lot,
Hmm.
of being able to see, oh, there's somebody that looks like me, has probably lived a similar life to me, is a big thing. Again, having it be a female driven field,
Okay.
a lot of times black men in general, and men too, might have a hard time coming to a woman and being that vulnerable and being able to have their flaws pointed out, when sometimes you're at home and your flaws are being pointed out in a negative way.
Daily, daily being important.
So that is something that a lot of us struggle with, I can say.
Okay.
But overall, also, I think it's just the exposure. We
So
don't really see that.
let's talk a little bit more about culturally and say more about the historical nature of therapy or lack thereof in our community.
Well, therapy, we never really had the structured therapy, right? Culturally, where a lot of that, when we talk about slave times, that would be the person who was probably the pastor
Hmm.
there, or would be big mama figure. And then, as black men, when we had strong men back then, they were pretty much beat down intentionally to let everybody else in the community know, like, hey, if I was able to beat that brother down,
Hmm. Hmm.
the rest of you guys,
Don't
I don't
have a
want to see
chance.
the strength.
Hmm.
So therapy for us was the church, our mothers, and you guys know the barbershop, places
That's
like
right.
that.
And the bar,
Bar, yeah.
unfortunately,
Yeah.
and people self-medicating
Mhm.
through this environment.
Right.
Not advocating for that, but it happened in our community. And so, moving just a little bit more in that culture, when we think about slavery and the toll that it took on us and the resilience that it took to get us through that, how often do you now hear from clients that, I'm tired of being resilient, because we've had to be resilient through a lot of things, and having that strength has kind of been our stamp of approval to becoming a man.
Right.
But we're not always strong.
Right.
We're not always resilient.
Mhm.
And where do we go when those days happen that you don't have it
Mhm.
for your family?
Well, a lot of it is the pressure, right? We have the pressure to always be performative. And what you just described is a lot of men feel like we have to be performative at all times.
Mhm.
We can't let our guard down, because if we do let our guard down, now everything we do is questioned.
Mm. Yep, it's
So
true.
a lot of that, it comes with, like you said, our self-medicating with alcohol, marijuana, other drugs. I do video game therapy,
Okay.
and a lot of our young men play a lot of video games.
What are the age brackets that you do the video game therapy?
Um, I would say probably about 6 to however old. I think my oldest client that I've used video games with was 81.
Did you say 81?
81.
Oh, okay.
Yeah.
I'm 55 and I don't even ever use a controller now.
Yeah.
So 81 years old.
Mhm.
How did that benefit? If you don't mind talking a little bit more about how that benefited that client at that age.
Well, a lot of it was, me using video games and technology really provides a person a third person perspective, or and also another person to come in, because you're really observing the character in those forms of media, and you're being able to put yourself in that character's shoes, or say that character is in my shoes, and you
Hmm.
have the ability to make choices, You have the ability to see things through. And I feel like a lot of us, to kind of coincide with your other questions, especially Black men, we live in this traumatic first person perspective, right? We're always playing Call of Duty all the time, right? We have to make
That's a good way to look
quick
at it.
decisions. We have to do this. We have to, oh, you're 6, check your 12. Okay, we're low on resources.
Mhm.
As opposed to, we play a third person game, we're able to see the whole map, we're able to see all our enemies, make mistakes. If we were to die in a video game, we know we can respawn, learn our lessons, figure that out. But in first person, it's make or break. It feels like that all the time.
That one
That's the
decision.
pressure that we normally have. And so my goal is to get people to look at life in a third person perspective and realize mistakes happen. And just like for men, but I would say Black men in general, our mistakes feel like they define us, as
Mm.
opposed to our mistakes defining us and us being able to show that resiliency and show the generations behind us that you can make mistakes and bounce right back, as opposed to we make mistakes and you stay there.
It's funny that you mentioned that. When you talk about generations behind us, my father, my grandfather were men of, again, learning on the fly.
Mm.
You got to figure it out. I ain't gonna hold your hand through whatever you're going through. I'm gonna give you my opinion. I'm gonna tell you what it is. That's what I got for you.
Right.
Now, when it comes to therapy, therapy is another way to give those tools. And so, how when you getting this information to your clients, do you give them the idea of what therapy is and what the purpose of it is?
This is going to sound, I was trained for a decade I would say, from undergrad through my PhD program in terms of school. And a lot of it is being relatable, you know, being a person and not being a practitioner,
Okay.
right? You know, you want your clients or patients to be able to see that there's a person behind the information. And I'm not here to give orders. I'm here to help and here to be able to empathize with what you go through, but also to give direction and options.
Mm-hmm. Mm-hmm.
And I think therapy in general has been kind of stigmatized as you're in a place where somebody's to judge you,
Mm-hmm. Mm-hmm.
where that person shouldn't be judging because trust me, we go through stuff.
We're all human, right?
Yeah, we're all human.
That's right.
So it's more so just saying, hey, this is what's going on with you. How can we make that better? And understanding that it takes time. It's not a one-stop shop.
Okay.
It takes months.
Well, that leads right into our next question: is the stigma around mental health is one thing, but there's also the question of trust. Many Black men feel therapists don't understand their lives, experiences, whether it's racism, code switching,
Mhm.
Navigating predominant white spaces.
Mhm.
And you've answered a lot of this. How do you build that trust, and why do you find how do you find the right therapist,
Mhm.
which matters so much?
Okay. So this is probably going to be something that's going to get me in trouble with some of my colleagues.
Okay.
So,
Okay.
but I'm going to say it. This is how I do my therapy. What you said is true. There, majority of therapists, if you look at it statistically, aren't going to identify with those things that you listed off from a Black male's perspective.
Mm-hmm.
Because, like I said earlier, if I'm in school and I'm being told I'm a unicorn, I'm going to conferences and people are saying, wow,
Mm-hmm.
you did this?
Mm-hmm. Mm-hmm.
Man.
So can I stop and ask, how did that make you feel in that moment? Did you feel safe? Did you feel heard, or did you feel secure in that moment?
I would say, I would say I'm one of the lucky ones to have grown up with a Black male therapist
Okay.
because my dad is a therapist. So that was something that I was used to. Just even as a kid, seeing like I know my dad is a unicorn. I know I don't see black guys in these spaces at all. And that was part of the reason why I wanted to continue what he did.
Okay.
But how that made me feel, it was, I chuckled, because I, just as a guy in general, the guys, whether regardless of whatever race, you know, sexual orientation, whatever, we always laugh and say, yeah, there's not a lot of us here in general, because this is a predominantly female dominated field.
Correct. Correct. I was just at the Black Mental Health Conference in Durham. No, I'm sorry, in Raleigh earlier this week with Dr. Lucas. And as I scanned the room, you're right. It is predominantly minority females that dominated the room. It was probably, I would say, 15-1 ratio in the room. And the question I asked her is, how do we get more men understanding the value of having mental wellness? And she looked at me and she was like, hey, that's a very good question. But we got to bring things like this to the forefront. Like the barbershop has typically been our space to go in and just decompress.
Right.
Man, it's been a long day. And as far as being a barber for over 30 years, I was not equipped for that. I developed that skill set over the years. When I first came in there, I'm sure I gave some really bad advice that nobody should follow. Because I was 25 years old cutting hair. But over the time frame, you started hearing the same patterns emerge. You start hearing everybody's having the same problems. Everybody's going through the same type of issues. So, I started thinking, we need to develop something a little more consistent. So some of the principles that we work off of is active listening, open-ended questioning, empathy, no judgment, connection, that's that trust. And then we try to get the resources to the people, right? Again, I'm a barber. I have not been to school for 30 years to figure this out, but the patterns are evident. And so from hearing that from a barber, how do you feel like we can bring more men to the space of being open about, their emotional awareness, their conflict resolution, their communication skills, all the things historically that has led us to, this impasse?
Well, I would say, so again, another loaded question.
Wow. Yeah, I'm full of
great. This is great. A lot of it is more so outlining it. How I tell my clients, I said, sometimes we have to talk to each other like we're 3 years old, right? It's not that your mental capacity can't handle it, but if I'm new to something, right, I want to be kind of saying, hey, this is step 1, this is step 2, this is step 3. The same way that I'm sure you would do with your kids or anybody that's new, right? If you're training somebody to in barber school, right? I'm sure you guys are like, hey guys, this is how you cut. This is the grade that you use, right? Those type of things. And I think it's more so when a person's saying that, say, hey, I noticed when you said this about this situation, you seem dismissive, right? It's learning to talk to one another in a way to not solve their problems, but be able to tell them this is how you're sounding.
So you're more of a sounding board so you can hear yourself.
Right. Say, hey, this is what you sounded like, dude. Was this what you wanted to come across? And then 9 times out of 10, they'll say, nah, bro, that's not what I wanted to say. I want to say this. Okay.
I meant this.
I meant this. Okay, well, why don't you go tell her that? Or why don't you go to your boss and kind of figure some things out that way, as opposed to you having to be the end all be all.
Right. My way is right.
Yeah.
Correct. And that's what I'm finding is a lot of time is inflection in your voice.
Right.
It's the emphasis on a particular word that we're not fully aware of. To your point earlier, is just talking about the terms when it comes to speaking to people in a mental health fashion. Like a lot of people don't want to go to a doctor or a therapist because they feel like they're going to talk to them over their head, for one. And quite often that does happen.
Exactly. Yeah.
And that's when we talk about trying to find a good therapist. I liken it to trying on clothes and shoes. You go into a store, You don't always pick the first pair of shoes you put on. You don't always pick the first shirt you put on or pair of jeans. You try the one that fits well with you, and that comes from attempting the conversation,
Mhm.
hearing what that person has to say, and just for me, this is how it worked for me.
Right.
I go see a therapist every 2 weeks.
Mhm.
I had to see maybe 3 or 4 just to get somebody that I felt comfortable with, that I trusted was in the right age range. They they could understand what I'm going through as a person.
Mhm.
I've had therapists that don't look like me,
Right.
and they were good therapists. They just might not have been the one for me.
Right.
And so, in finding one that is right for me, I had to go through the process. And from a therapist standpoint, what would you tell people, is a good method of process in trying to find a therapist?
Oh, shoot. I guess I'll talk straight to the people here.
Please.
Being able to say, um, find a therapist that challenges you. 100%. Always find a therapist that challenges you. Uh, I've had plenty of clients come back to me and say, I tried other therapists, but nobody challenged me the way that you did and just told me the truth. A lot of people sugarcoat things, just like any relationship. That's what a therapist and a client or patient relationship is. It's a yin and yang. If you don't see that therapist growing alongside with you, and the person isn't pushing you in a way, and when I say pushing you, it doesn't mean putting you in uncomfortable situations, but having you sit in the truth of your situation and watching you squirm a little bit, watching you be uncomfortable. Or if you're in a couples, saying, hey, I'm going to challenge the person that wanted to come in here to do this couples therapy and try to figure out why they really wanted to do it. Those are the therapists that oftentimes people run away from, but 9 times out of 10, those are the therapists that are going to give you the best results and give you lifelong lessons.
Okay, thank you for that. Now, is it fair to say, from what you just said, that change typically comes when you're uncomfortable?
Mhm.
And most people have a tendency to live in, sometimes, I guess what you would call is a trauma or whatever that they're comfortable with,
Mhm.
or baggage that they're comfortable with. How do you talk with your clients when you find somebody that's stuck? Either it's anger, it's stress, anxiety, but they're comfortable in that anxiety or in that stress. But every time you say, hey, let's take this direction, they always bring it back. Well, I'm all right here. I'm good. And this is my safe space.
Well, I always tell my clients, we have to challenge your negative homeostasis, right? And
I don't know what
that's
that means.
that's one of those big words you were talking.
There it is. There it is.
That's one of those words.
Break it down, homie. Let's go. Let's go on all with
Yeah.
that.
So what we're talking about is, like you said, that negative space, right? A lot of times people are comfortable in chaos. We always have that cousin that's like, man, he always in some stuff, or she's always in some stuff. And then when things are peaceful, you're like, it's too quiet. It's too
I gotta
quiet.
find something to get
They gotta
into.
find something. And then you get that phone call. Well,
There you
there
go
it is.
again.
There it is. Right.
Mm-hmm. Mm-hmm.
A lot of that is going to be, I always tell people, when we're in that quiet space, we have to be able to see who around us is uncomfortable.
Okay.
Because a lot of times the people that are around us that are uncomfortable, they're acting like us, the chaotic person, right?
So they're mirroring what you're
Mhm.
doing.
They are
I learned.
mirroring
I
what
learned
you're
that.
they go, yeah. They are mirroring what you're doing. And something inside of us says, that's not supposed to be how it's done. I'm supposed to be the one that's triggering it. So what do? They go back, they say, oh man, they were doing good. Why they do that?
Okay.
So
Okay.
a lot of it is
Yeah.
just,
Speak more than that.
yeah, so a lot of it is just more being aware of your environment. So I tell my clients, I say, okay, guys, we're in a good space right now. So let's start looking at the people around us.
Mm-hmm.
Who's acting like us? Who's mirroring our behavior?
And how would you tell them to step back from those people if they can identify them? Because it's hard to step back from people that you're comfortable in. You know, as a again, as a barber, I have friends, I
Mhm.
have family, I have clients, and then I have people that are, my boys.
Mhm.
And on occasion, it's hard to step back from those ones that are your boys. You can't step back from your family.
Mhm.
That's pretty difficult. But how do you tell people to step back from that person that you identify?
Okay. So, you know, and I'm sure we all know, a person isn't always going to step back away from that person unless something crazy happens, right? It's like I always tell my clients, we're just going to be real about the fact of this person's going to be in your life. We just got to figure out how that person's going to be in your life and what new role they can provide that's comfortable for you and them. So I would say, hey man, is you're the casting director, you know. I'm sure like Ryan Coogler said, hey man, you know what? I probably wanted to cast somebody else in the Killmonger role that wasn't Michael B. Jordan, but that person's now probably playing another character in there. I wanted to keep him employed.
Hmm.
I wanted to make sure this black man was employed, but you're not Killmonger.
Okay.
But you're still in Black Panther,
Okay.
right? So you can keep them in Black Panther, but they're just not as important to your plot as they were before.
Hmm. Okay. So now, what if when you got clients that are actively living in chaos though,
Mhm.
like their whole surrounding,
Right.
and every time, you know, they go to their other friends to get counsel, there's that person that's
Mhm.
always the chaotic, that cousin you just talked about. How does that person, if that person comes into your office, what's the first step with them? How do you
Cousin or the
the
guy?
cousin,
Okay.
the chaotic cousin
Okay.
that is always the thorn in the cousin's side. It's always
Mhm.
going to do something that's going to throw everybody off. If you ever get that cousin in your office
Okay.
to come in and sit down, I didn't, man, I can't do nothing else for you. You got to go talk to somebody that
Mhm.
I can't give you the tools, and
Right.
I got him. We talked about him. We got him in there. How do you approach a person that is the chaos?
Oh man, that's going to be more understanding their family history.
Okay.
A lot of the time, get them grounded in that. And I like to do a thing where I have a person understand what part of them died at what age,
Mm.
right? Because when we talk about chaos, some people will argue, I'm sure you've heard a debate, are humans born evil or not,
Right.
right? I don't think humans are born evil. I feel like they're made that way. So it's going to be more so of kind of like what part of you died and when, and are you still mourning that person, that stage, right? And see that the actions that you're doing, they're bad.
Mm-hmm. Mm-hmm. Mm-hmm.
Even sometimes that cousin by law, they're bad, but there's also depression in what you're doing.
Okay.
It's not just anger, right? Because sadness can be projected in different ways. And understanding that, and then that you have accepted this role because this makes you the most comfortable. And I'm sure, right? You know, crazy cousin Faith, we're doing that.
Mm-hmm.
She's not always crazy 24/7, you know,
Gotcha.
and kind of mapping those things out. So I would give them things to physically kind of really look introspectively day in, day out, 2-hour check ins, things that are triggering you environmentally,
Okay.
right?
So if that person comes in and they are, wanting to know what to expect. This gonna be a 2 day fix? Is this gonna be a year long fix? How long do I gotta come in here to see you?
Right.
Okay. For instance, somebody came in, court order, anger management, something like that.
Mhm.
And they've been getting in trouble on a regular basis because a lot of things is taking that first step, right?
Right.
And getting people to understand that somebody that might be listening to this to say, you know, I need to really, do something, but I don't know how to do it.
Right.
And therapy, everybody keep telling me I need therapy. I don't know what that crap is.
Mhm.
I don't need that, but they do.
Right.
And so as we're going through these steps of getting people into, what would you say to a person that 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 needs it,
Mhm.
but they're afraid of what it might expose?
Okay. So when you're talking about a person who's court ordered that has to go to therapy, right? One, you
Got
better be going to therapy. You better be going to therapy if you're court ordered to go to
Mhm,
therapy. But when I've had people that court ordered to go to therapy, I always kind of make up a plan to say, okay, how do we make this extend beyond? Because to me, there's no time stamp on therapy. Um, I have people that are going to be in therapy for a lifetime. That doesn't mean something's wrong with them. It's just saying, okay, I have a space where I have 50 minutes to an hour a week, every other week, monthly, to where I can just let out what I want to let out, understand that I have somebody that's going to listen to me,
mhm.
that wants to listen to me, that's going to give me feedback on what I need to do to improve myself.
Okay.
Right?
So is it fair to say that going to therapy and with the right therapist, you get to make up the rules of how this works for you?
Absolutely. This is at the end of the day, because this is all relationships are transactional,
Mm-hmm.
right? But at the end of the day, with you and your therapist, I hope that people develop a very good rapport with their therapist to where, people I've heard people talk about, oh my, hey, that sounds like it's a friend more than a therapist. I
Mm-hmm.
always tell people that's a good thing.
That is a good
That's a
thing.
good thing, depending on
The
if that the
dynamics.
dynamics, right? You don't want a therapist that's projecting their stuff
Mm-hmm.
onto you.
Mm-hmm.
The moment that you feel that, run.
Can you say that one more time? I want to do it. One more.
You do not want a therapist that's projecting their own stuff onto you. If you feel that, run for the hills and find a new one. But if you have a therapist that you feel comfortable with, that you say, I can be myself, I can actually have a conversation with this person, they get me, they make jokes, they're not getting so personal about their own stuff, that's your person, right? We hear this all the time about romantic, like, oh, I want to find my person, my person, my person,
Mm-hmm.
my man type
Right,
thing,
right, right.
right? It's sometimes you find, and I know for some of my clients I found, I'm like, wow, okay, this in terms of your therapeutic soulmate,
Mm-hmm.
that happens. That's there. It's like, oh, yeah,
So the
you just
conversation is
click.
easy.
It's easy, it's comfortable. You can challenge your client challenges you. I always tell people, I say, hey guys, if you feel like I'm not on my A game, call me out on it. Call me out.
How do you call a therapist out of if I feel like Owen is not Owen? Oh man, we've been talking for this long. I don't feel like I'm getting nothing out of this. How do I call? How does a person feel the confidence and comfort to bring that to somebody that went to school for 30 years?
Again, that's going to be based off of one, the relationship and the humility of a therapist, right? I always tell people I'm a doctor, but I'm a person first, right? You don't have to call me Dr. Owen Guess in session. You can call me, oh, whatever, as long as you're not cussing me out.
Hey,
We're good, right? But I think if you have a therapist that outwardly says challenge me, do it.
okay.
Don't be rude about it. Don't be rude, but challenge them. If you're saying, hey, you know what? I felt like you didn't really meet me where I wanted you to. I need you to be better, right? We're people too. We fall short, but you have to you have to know when a person is grounded in themselves within their profession.
Okay. Okay. So we've talked about some of the things to look for, I guess, what you will call green flags.
Mhm.
So if you were looking for a therapist yourself and thinking about red flags,
Mhm.
what would some of those be?
We talked about one, a person projecting their problems
Mm-hmm.
all the time, right?
Mm-hmm.
Um, if a person is, I would say, a person is routinely late all the time
To your sessions?
to a session,
Okay.
and there's no real, hey, this is what's going on. There's an emergency. Um, a person who's faked their degree, it's a big one, right?
Hold on, time out. You just said fake their degree?
Yeah, there are people out there that fake their credentials all the time. There are people out there that fake their doctorate, masters, those
Okay,
things.
yeah, I can see that.
You know,
So how do we look up the person since we're in this
how you
in
do that?
this
Oh, you can go into, especially if they're social. There are websites that you guys can go to that if they're a licensed counselor, they can go to. You just say, hey, licensed counselor, state of North Carolina. It should pop up that official website, and you can type in a person's first and last name. You can see if they're still their license is still active.
Okay.
So that means they went to school and they had good grades if they had
Okay.
that.
Okay.
For
Okay.
social workers like myself, you can go to NESW, N as in Nancy, ASW.org.com is one of those. Or you can just say look up social work license, and you can type in Owen Guess, and you're going to see when I got my license, and you're going to see, oh, this is when it expires, all those things.
Okay.
So yeah, so to be able to get those things, for me to have MSW, LCSW behind my name, all those letters, you can go, you ask where they went to school. You can look that up, say, oh, did they actually graduate? All those type of things. Or did they actually attend the school?
Okay. Perfect. Perfect. Let's shift gears just a little bit, on this broader impact. Um, you work with preteens, adolescents, and adults. What patterns or mental health concerns have you seen in young males today that worry you the most?
Insecurity. Insecurity is at an all-time high, I can say. Um, Lack of communication skills is a big one. Um, I think those would be my big two,
Okay.
right? Because anger is always going to be there. That's just part of growing up, but the level of anger differentiates between kid to kid or teenager to teenager. But self-esteem and communication skills are the big ones.
So how does that show up in these kids in that you that the are there patterns that you've seen that shown up more prevalent than not?
A lot of these are it's a mixed bag between things that have always been and new things that are now happening,
Okay.
right? With social media being as prevalent as it is, right? Me being millennial, we had AOL,
Yep.
right? Dial up, you had AOL, all those things, and then Facebook was a thing, and then now you have, I call it Twitter, as Mama called it Twitter, I don't call it X.
Okay.
So
Okay.
Twitter, Instagram, Snapchat, all these other stuff, and it's a lot of the self-esteem comes off of things that we've heard before. Kids can't escape
Okay.
a consistent conversation, because even like I said, even when I was in school in 2000s, I could escape if I did something wrong, if I busted my behind in the cafeteria, I knew at least I might have this bus ride, but they might get me on this bus ride. But as soon as I get home, I have some peace. I can't just go on my phone and see, oh man, they talking, oh, just bust his behind, dude. This dude's dorky. Da, 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 da.
It stayed confined
Yeah,
within that school or in
yeah.
that class, whatever the case. But now it's all over the whole
Mhm.
internet, which creates a level of anxiety with our young folks, right?
Anxiety, and then it's the self-esteem, right? Because now that post is there forever.
Right.
That post until somebody actually deletes it. And then if somebody deletes it, somebody could have taken a screenshot from it and say, I'm going to keep it going. Right. So those things are the big ones there, right? It's the social media aspect of it. Then it's going to be for us, it was I sound like one of these, it's the old school ESPN guys where they used to talk about Kobe Bryant when they said he doesn't have the street cred. Kobe doesn't have the street cred, right? Now it's more of like, where's my clout at?
Already, and I ain't even
Clout,
starting.
right? It's like you're 12. We ain't talking about clout. Like they would tell us you're 12. What you talking about street cred?
That's
This
right.
doesn't make any sense, right? So it's some of the same problems that we had growing up, but framed differently.
Gotcha. Gotcha. So with that being said, and I say this with a deep breath, what gives you hope about the next generation um, with mental health?
They're more open. I can say 100% from, I would say, mid millennial on. If you say you need a therapist, 9 times out of 10, they're going to say, okay.
Okay, that's true.
Like,
I would say that's true.
I think it's the stigma of going to see someone and talk about things, or even just sit in a room for months on end and not say anything and go back to school and say, yeah, I've talked to my therapist. Nobody's going to look at you weird, right? It's not a, oh, you crazy. It's like, oh, so you got a therapist, you must got money.
Right. And well, being that's another point right there. Financially, you know, a lot of people feel like they can't afford therapy.
Right.
And especially the older generation, you go somewhere and tell them you got to spend $100
Mm.
on a session. I'm not doing that. If I got to go twice a month, they start calculating in their head. Oh, that's $17,000 for this year. I
Right.
can't afford that. So how do you speak to, you know,
Mm.
those generations that talk about the financial component of therapy and how they can alleviate some of that pain?
A lot of that is just going to be, how much do you want to, therapy is upkeep for yourself, right? A lot of people, they'll do upkeep on their house, they'll do upkeep on their cars, their gardens,
Mm-hmm.
all those things. They'll go travel, right? I would say, well, how much do you really care about you? Because not all therapists, you know, charge $100 per session, right? It's finding a therapist that you can afford, that's good enough. But then sometimes, and I'm saying this in the wrong, I'm saying this in the wrong climate
Okay.
right now, but sometimes you have to say, okay, am I really going to let money dictate my peace at this point in time? Is with me not getting, you know, this bottle of wine for this period of time for this month,
Mm-hmm.
as
Mm-hmm.
opposed to going to a therapy session, is that really going to kill me?
Okay. So what I'm hearing you say is, what are you willing to invest into your mental wellness?
Exactly. You
Okay.
know,
Okay.
that's a big thing, especially you're talking about within the Black community, because we invest in so much other stuff. We invest in so many other people.
Mm-hmm. Mm-hmm.
And when it's time for us to invest in ourselves, we always make the excuse, right? It's the big mama syndrome from soul food.
That's right.
Right?
Right.
It's like, big mama, your arm.
Explain that to folks who might not know who Big
Okay.
Mama is.
So Big Mama, in the movie Soul Food, would have Vivica A. Fox,
Mm-hmm.
uh,
Mm-hmm.
Nicole Ari Parker.
Mm-hmm.
What's my boy Lim? Who was my boy Lim?
That's a good question.
Omar something.
Omar Epps.
Omar
Epps.
Epps. Omar Epps. Yeah. So it's a movie based off of the tradition of black families gathering together to eat on Sunday dinner soul food. Your fried chicken, macaroni and cheese, all those things.
All the good stuff.
And the character Big Mama, like in everybody's majority of people's, I'm not gonna say everybody's, majority of people's black families, you have your grandma that's cooking all this stuff. She's a very selfless person.
Mm-hmm.
Selfless to a fault, to where her body could be
Falling
apart,
cooking.
mint stability. But hey, as long as the family together, I'm good. Big Mama had diabetes. They just said, hey, if you got your diabetes in order, you still be here with us. She didn't get herself together.
She left this earth.
Yeah, she left this earth too soon.
Okay. So then this has been a lot of good information in regard to getting to the bottom of why black men don't go to therapy. It's really layered. We got a lot more to uh, get to solutions. We're not going to solve all the problems. I definitely understand that, but I appreciate you taking the time, and I would love for you to come back again to as this series progress. Today we're going to have a group of men come in and just let them talk to us about what issues they're feeling, where their mental health is, how they would maintain their mental health, where they're comfortable talking about it, and gain some data that's called the Man to Man Healing Conversation Series. And thank you so much for being a part of this. Now, before we leave and end this out, is there anything that you want to leave our listeners with today? As far as when it comes to your wellness, your maintenance, your self-care, and your ability to show up for your family and yourself.
Overall, the big thing I always tell people, make sure your physical health is aligned with your mental health. You can't just be going to the gym 24/7 and not working on your mental health. You can't just be working on your mental health and going, and not going to the gym. Everything coincides, especially for men, right? We can hide in one of the two or not even do one of the two. Try to perform balance in your life and talk to each other, observe people around you.
All right. Sir, thank you for that.
Man.
So this has been another episode of Barbershop Therapy. We really appreciate your time, your energy, and considering us for your podcast. We'd like to thank Dram and Drought for letting us take over their establishment for a few minutes. But this is Jimmy Evans, your host, and this is Barbershop Therapy. We cut through the problems.